Hello again, everyone. Thank you so much for joining me. I'm Frederica Whitfield. All right, encouraging signs in the U.S. fight against the coronavirus, but with new variants emerging, experts warn everyone must remain vigilant. First, the signs of progress. Vaccinations are now outpacing new cases. The U.S. is averaging 1.3 million vaccines administered every day. That's up from 1.1 million just last week. And new cases and deaths are dropping in most states across the country. But the U.S. is seeing an increase in some of the new variants of the disease. Virginia just reported its first case of the South African variant. And the CDC says more than 600 cases of new variants from South Africa, the UK, and Brazil have been reported in 33 states. With that in mind, the CDC is warning Americans against holding large Super Bowl parties tomorrow, indoors especially. New guidance says that you should only watch the game with people you live with to prevent any new outbreaks. And in New York, Governor Andrew Cuomo says his state is seeing a rapid decline in both positivity rates and hospitalizations, and it comes as vaccinations are ramping up across the state. CNN's Evan McMorris-Santoro is outside Yankee Stadium. Evan, who is getting vaccinated today?
Well, Fred, I'm here at Yankee Stadium, and what you're seeing behind me is kind of the best-case scenario for how vaccinations are supposed to work. This is obviously a massive site designed to move thousands of people in and out of in a quick period of time, and that's what's happening here in the Bronx. People who are eligible here in the Bronx in this borough are able to come and get vaccinated today and tomorrow, and there are 15,000 appointments available this weekend. Thousands of them have already filled up. Now, the plan here is to try and target this borough, which has been one of the hardest hits in the city and still has one of the highest percentages of infection rates of the entire city. So that's how it's supposed to work, and it's kind of actually working behind me. People have been lining up, they're getting vaccines, they're coming out. The main challenge remains here, the actual availability of vaccine. City officials and state officials say, look, they can build sites like this all over the place. They can move a lot more vaccine to people's arms. They just need the doses to do it. So you're seeing behind me a sign of an actual success story behind me. They just need more doses to make it even more of a success story, Fred.
Increase that production if possible. Evan McMorris-Santoro, thanks so much in New York at Yankee Stadium. All right, meantime, on the other side of the country, California Governor Gavin Newsom is facing a recall threat as frustration over the pandemic grows across that state. Organizers say they have collected more than 1 million signatures supporting the effort to remove him from office. They need 500,000 more to get the recall process put into motion. This as California becomes just the second state in the nation to surpass 43,000 coronavirus deaths. CNN's Paul Verkaman joining us now from Los Angeles. So, Paul, what more are you learning?
Well, we're learning that we are starting to see some of the variants crop up here in California. And let's get right to Dr. Barbara Ferrer. She runs county health here in Los Angeles County. And how do you get ahead of the threat of these variants?
It's such a good question, and good afternoon, everyone. I really want to note that the variants are really mutations of a virus, and almost all viruses mutate. The strategies that we have in place right now, keeping your face coverings on, keeping your distance from other people, washing your hands, those will protect you against the variant. You just have to do them all of the time, particularly if we're suspicious that the new variants that might be circulating can, in fact, more easily infect other people. So, you know, we've got the tools. We just have to use them.
And as we look over your right shoulder, we see people who have just received a shot in their arm. These are all first vaccines, but you have said that you could be vaccinating way more people at sites such as this. You just lack the vaccine.
Yeah, I mean, it's, you know, it's the heartache right now. So many people want to get vaccinated. This site here could accommodate easily 4,000 people getting vaccinated a day, really 4,000 cars, and we just, we don't have vaccine. Today we were only able to release 1,100 appointments.
Right now in Los Angeles County, people 65 and over, healthcare workers getting vaccinated. What group gets added next to the list?
There are 3 groups that will be added at the same time here in the county. It'll be education and child care workers, food and agriculture workers, first responders, public safety, and law enforcement. And hopefully in the next couple of weeks, if we get more vaccine, we'll start immediately being able to roll out vaccines for all 3 of those groups.
And a lot of small business owners begging you to allow allow them to reopen? Any light at the end of the tunnel for, let's say, indoor dining and this sort of thing?
You know, I think we're a ways away from indoor dining. Let's just face it. The virus is really easily transmitted when you don't have a face covering on. So when you're indoors to eat or drink and you have to take your face covering off, that's like the perfect environment for this virus to get transmitted. And you know, usually when you're going into a restaurant, there's lots of other people there. There are workers there. They're not in your household. So no, I think we're a ways away from indoor dining.
Before you know it in California, this is almost hard to say, but we're going to reach 20,000 fatalities. I'm going to play a clip from you in December when we reached 8,000 fatalities, and you were extremely emotional.
Over 8,000 people who were beloved members of their families are not coming back.
I'm wondering, how are you holding up with all of this? And was there ever a moment where you thought that this was just becoming overwhelming and maybe you wanted to do something else?
You know, I've never felt like I needed to do anything else, but overwhelming, absolutely. Heartbreaking, almost on a weekly basis. You know, so many families have lost people that they love. So many families have really also experienced the hardship of having people that they love in the hospitals for long periods of time. So much devastation, economic devastation, and the devastation that's caused by losing thousands and thousands of people. You know, there are days where I've had to report over 300 people have died and passed away. I don't see how that wouldn't be overwhelming for anyone. But, you know, we're all in this together. I've got a job to do. I'm surrounded by wonderful people helping us really try to make sure that we've got a path forward that really helps all of us protect each other, because that's the name of the game right now. We can do stuff that is pretty easy to do that will allow us to, in fact, reduce the number of people that are dying, reduce the number of people that are in the hospital. We just have to stay focused.
I super appreciate your taking time out, Dr. Ferrer. I'm going to toss it back to Atlanta now. I also want to just paraphrase really quick, Fred, what Dr. Ferrer said about tomorrow in the Super Bowl. Don't be mixing together a bunch of different people from different households in one party. Back to you now, Fred.
Right. People cannot hear that enough. Dr. Ferrer, Paul Verkammen, thanks to both of you. Appreciate it. All right, keeping up with the target pace of vaccinations will take a huge amount of resources, including manpower. That's why the military, the U.S. military, is providing troops to try to keep things moving. Oren Lieberman has more from the Pentagon.
Secretary of Defense Lloyd Austin approved the deployment of about 1,100 troops to 5 different vaccination sites as part of the Department of Defense's effort to help FEMA build up and support COVID vaccination sites. The first of these teams of about 220 will deploy within the next about 10 days or so to one of 2 vaccination sites in California, either in Oakland or in Los Angeles. That's up to FEMA, and it's unclear yet where those troops will be helping out. The team of 220, each team, in fact, will have nurses, vaccinators, command and control, as well as clinical staff, general staff, and others to build up what are intended to be these mass vaccination sites. Now, 1,100 troops is still far short of the full FEMA request for 10,000 troops. But at this point, even FEMA has acknowledged that build up to those sorts of numbers that could deliver up to 450,000 vaccinations a day would be incremental. So this, it appears, is just the beginning. How long will each of these vaccination teams remain in place? That will be a discussion between FEMA and the Department of Defense before they can wrap up at one site and perhaps move to another site where they are also needed. Oren Lieberman, CNN at the Pentagon.